5 medical checkups that seniors over 70 should seriously reconsider. Because in many cases, they may do more harm than good. There's an uncomfortable truth hidden in modern medicine that rarely gets discussed openly. Every year, millions of seniors file into clinics, lining up for routine health screenings under the belief that early detection is always the safest choice. But what if I told you that some of these very tests, commonly prescribed, even advertised as life-saving, can sometimes set you on a path toward unnecessary surgery, dangerous complications, and even cancer itself? Recent studies have revealed a disturbing trend. Nearly 37% of medical tests performed on seniors result in overtreatment, complications, or lifelong side effects. Even more shocking, an estimated 99% of people over 70 have no idea they're being overtested. And here's the most jaw-dropping fact. One of these so-called routine checkups is responsible for 5% of all cancer cases in the US, the same risk attributed to drinking alcohol every single day. Yet you'll never see this warning on a clinic poster or TV ad. The truth is buried deep in the science. That's why today, we're pulling back the curtain. In this video, you'll discover 5 medical checkups seniors should avoid after 70, and the frightening ways they can quietly sabotage your health. Everything we share is backed by peer-reviewed research, and what you'll hear at number 2 may completely change the way you think about your next doctor's visit. But before we dive in, I want to hear from you. Where are you watching from? How old are you? Have you ever regretted a medical test or procedure? Share your experiences in the comments below. We read and reply to every single one with tailored advice and tips. And if you're passionate about protecting your health and the health of your loved ones, make sure you hit that like button and subscribe for more science-backed videos just like this. Now let's start with number 5, a test that seems harmless but can quietly disrupt your quality of life. Number 5, the bone density scan DEXA. On the surface, a bone density scan sounds like the safest checkup you could possibly get. No needles, no pain, just a quick scan, and you walk away with a number that tells you how strong or fragile your bones are. But here's what most doctors never explain. After age 70, these scans often raise more alarm than benefit. That's because bone loss is a natural part of aging, just like gray hair or wrinkles. A DEXA scan will almost always show reduced bone density in older adults, even when there's no real risk of fracture. But once those results appear on paper, many seniors are pushed toward medications like bisphosphonates, which promise stronger bones but come with serious side effects. These include esophageal irritation, digestive inflammation, and in rare cases, osteonecrosis of the jaw, a condition where parts of the jawbone literally begin to die. The science tells us the benefits aren't as strong as advertised. A large study published in the Journal of the American Geriatric Society followed over 1,200 women aged 70 and older and found that bisphosphonates reduced fracture risk by just 0.3% after 5 years. In other words, the medication often causes more harm than the fractures it's supposed to prevent. To make this even more real, let me introduce you to Rosaline, a 76-year-old retired piano teacher. She had never experienced a fall, never complained of bone pain, and walked daily for exercise. Yet after a routine DEXA scan, she was diagnosed with osteopenia, a mild condition that isn't even osteoporosis. Her doctor immediately placed her on alendronate, a common bisphosphonate. Within 3 months, Rosaline developed severe reflux and jaw pain, so bad that she couldn't play piano anymore. When she sought a second opinion, her medications were stopped. Instead, she was placed on a holistic regimen: vitamin D supplementation, weight-bearing exercise using resistance bands, and a calcium-rich diet featuring sardines and leafy greens. A year later, Rosaline had no fractures, stronger legs, better balance, and was once again performing at recitals with full energy. This is the key. For seniors who are not experiencing fractures or falls, lifestyle changes often outperform medication. A study published in Osteoporosis International, 2022, found that strength training, balance exercises, proper nutrition, and correcting vitamin D deficiency lowered fracture risk by over 20%, far more effective than pills in many cases. So while a bone scan may look harmless, it can trap seniors into a cycle of fear and unnecessary medication. The better solution after 70 is to focus on mobility, nutrition, and strength, not numbers on a screen. But if you thought this was unsettling, wait until you see the next checkup. It's one that seems routine, but in some cases, it can lead to unnecessary brain surgery. Stay with me, because what comes next could change the way you think about modern medicine forever. Number 4. Brain MRI for memory loss. For many seniors, the moment memory slips become noticeable, misplacing keys, forgetting names, or losing track of a conversation. The first reaction is often fear. Fear of dementia, fear of Alzheimer's, fear of losing independence. Understandably, doctors frequently respond to these concerns by ordering a brain MRI, a highly detailed imaging scan that shows the brain's structure in slices. On the surface, this seems like a logical step. A brain MRI can reveal shrinkage, lesions, or abnormal growths. But here's the critical truth most people don't hear. In seniors over 70, the vast majority of MRI findings reflect nothing more than normal aging, not disease. The brain naturally shrinks slightly with age, and tiny white matter spots, called hyperintensities, are common, often linked to years of normal wear and tear on blood vessels. These findings are usually harmless. The danger lies not in the MRI itself, but in what happens afterward. Once these spots appear on a radiology report, they can spark panic, trigger further invasive tests, or even push patients into unnecessary procedures, including surgery. Worse still, the label of abnormal brain scan can cause lasting psychological damage, making seniors believe their memory loss is permanent or inevitably progressive. The numbers are striking. A 2021 study published in Neurology Today analyzed over 3,000 MRIs in adults aged 70 to 85 who reported mild forgetfulness. The results showed that 86% of patients had some form of abnormality, but only 3% of these findings were linked to conditions that could actually be treated. In other words, 97% of patients left with concerning scan results that offered no real solutions. Even more alarming, about 12% were sent for invasive follow-ups, such as spinal taps or even exploratory biopsies. Tests that carried far greater risks than the mild memory changes that brought them in. Let's bring this to life with James' story. James was a 74-year-old retired engineer who began worrying about his memory after misplacing his car keys several times and occasionally forgetting acquaintances' names. His doctor, concerned, ordered a brain MRI. The scan showed white matter changes, a vague but common finding in older adults. James, however, interpreted this as early dementia. The result? His life began to unravel. He stopped driving out of fear of getting lost, quit attending church, and even withdrew from social gatherings. His anxiety worsened, and ironically, his memory seemed to decline further under the weight of his stress. Months later, he underwent a simple paper-based cognitive screening test. His results were well within the normal range for his age. No dementia, no cognitive impairment. Once reassured and guided toward healthier habits, consistent sleep, daily hydration, memory exercises, and stress reduction, George's confidence returned. Within 3 months, his memory stabilized, and he felt like himself again. This story highlights an important lesson. Unless there are serious neurological symptoms, such as seizures, sudden changes in personality, rapid loss of independence, or signs of stroke, a brain MRI for mild memory issues is rarely useful. In fact, it often causes more harm than good. A far safer and more effective first step is a cognitive assessment test, like the Mini Mental State Exam, MMSE, or Montreal Cognitive Assessment, MoCA. These simple tools, often just a few sheets of paper and 10 to 15 minutes of questions, provide a far clearer picture of brain function without the risks of unnecessary panic or overdosing. They can reveal whether memory issues are due to normal aging, stress, sleep deprivation, or something more serious that truly requires imaging. The takeaway? For most seniors, brain MRIs aren't the answer to everyday forgetfulness. What's far more valuable is a thorough lifestyle evaluation, memory-focused cognitive tests, and targeted interventions like exercise, diet, and mental stimulation. And now, brace yourself, because the next test on our list is one you've probably had before, and it carries an even higher risk of leading to invasive, unnecessary procedures. That's why it earns its place at number 3, the cardiac stress test. Number 3, the cardiac stress test. For decades, the cardiac stress test has been a go-to tool for doctors when seniors report fatigue, mild chest tightness, or simply slowing down. The test typically involves walking on a treadmill while hooked up to an EKG machine, or sometimes being given medication that mimics the effects of exercise. The goal is to see how the heart responds under stress, particularly to identify blocked or narrowed arteries. At first glance, this sounds like a smart preventative measure, spotting problems before they lead to a heart attack. But here's the hidden truth. In people over 70, stress tests often cause more harm than good when used without clear, specific symptoms. Why? The problem is accuracy. Stress tests are notorious for producing false positives, meaning the test suggests a problem even when there isn't one. According to multiple studies, in adults over 70, the false positive rate can be as high as 40%. That's nearly half the time. What happens after a false positive? Patients are usually referred for follow-up procedures like angiograms, inserting a catheter into the heart's arteries with contrast dye, or even immediate stent placements or bypass surgery. While these procedures are life-saving when truly needed, they are invasive and risky, especially for older adults. Risks include bleeding, infections, kidney damage from contrast dye, and even heart attack or stroke during the procedure itself. The evidence is sobering. A 2017 study published in JAMA Cardiology reviewed thousands of cases and found that more than 50% of stents placed after stress test referrals provided no survival or quality of life benefit for patients without clear cardiac symptoms. In other words, many seniors underwent risky heart procedures that ultimately didn't help them live longer or feel better. Let's look at Ray's story. Ray, a 75-year-old retired postman, was still active and walked every day. During his annual checkup, he casually mentioned that he felt more tired climbing hills. His doctor, just to be safe, ordered a cardiac stress test. The results came back abnormal, and Ray was referred for a catheterization. Doctors found a mild narrowing in one artery and placed a stent. But the real problems began afterward. Ray developed kidney issues from the contrast dye used in the procedure, leading to a 6-day hospital stay and months of follow-up care. The irony? His fatigue didn't improve, because it wasn't his heart at all. It was age-related muscle fatigue and mild dehydration, simple issues that could have been managed without invasive testing. This story reflects a broader truth. Not all tiredness in seniors is heart-related. Aging muscles, reduced lung capacity, sleep disturbances, or even side effects from medications are often the culprits. Yet too often, the first stop is an expensive and potentially harmful stress test. So, what should seniors consider instead? If there are no classic signs of heart disease, such as chest pain during activity, shortness of breath on exertion, or severe fatigue that limits daily life, then a stress test is rarely necessary. Safer and more accurate alternatives exist. Resting EKG, electrocardiogram, a simple test that checks the heart's electrical rhythm while at rest. Coronary calcium scan, a low-radiation imaging test that shows whether calcium plaque is building up in arteries. Lifestyle risk assessment, reviewing diet, exercise habits, cholesterol, and blood pressure often gives better insight than a treadmill test. The bottom line? For seniors without obvious heart symptoms, a stress test may do more harm than good. Instead, the focus should be on prevention, managing blood pressure, eating a heart-healthy diet, staying active, and avoiding unnecessary procedures. Now, if you thought unnecessary heart tests were risky, wait until you hear about number 2 on our list. This test is so common that millions of seniors get it every year, but research shows it may expose you to cancer-causing radiation with very little benefit. Number 2 on our list, colonoscopy. This may surprise you because colonoscopy is widely regarded as a gold standard screening tool for colon cancer. However, after age 70, and especially beyond 75, its role becomes much less beneficial and far more risky. A colonoscopy involves inserting a long, flexible tube with a camera into the colon to look for polyps, bleeding, or early signs of cancer. While this procedure can save lives in middle-aged adults, the risks increase sharply with age. The preparation itself is harsh. Patients must take powerful laxatives that flush the intestines. For older adults, this can lead to dehydration, dizziness, fainting, kidney strain, and dangerous electrolyte imbalances. The sedation used during colonoscopy, often involving drugs like propofol or benzodiazepines, is another hidden risk. Seniors are more sensitive to sedatives, and even a short procedure can cause lingering delirium, memory issues, or impaired coordination. In some cases, sedation may trigger heart rhythm disturbances or breathing problems. The procedure itself is not without danger. A tear in the colon wall, perforation, can occur, which is a medical emergency requiring surgery. Bleeding is also a real risk, especially when polyps are removed. These risks are not just theoretical. A large 2019 study published in JAMA Internal Medicine examined more than 1.3 million Medicare patients aged 70 and older. The results were sobering. For every 1,000 colonoscopies performed on adults over 75, only 2 lives were saved, while more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio, clearly unfavorable. Even when polyps are detected, many of them in older adults are tiny, slow-growing, and unlikely to turn into cancer. Removing them may cause more harm than leaving them alone, especially when balanced against recovery risks. Take the real-life story of Dana, a 73-year-old grandmother who helped run a family bakery. She was healthy, had no symptoms, no bleeding, and no family history of colon cancer. Her doctor, eager to be thorough, recommended a colonoscopy. During the procedure, a small polyp was removed. That very night, Dana developed excruciating abdominal pain and fainted. At the hospital, doctors found a perforation in her bowel caused by the procedure. She required emergency treatment, spent 9 days in recovery, and lost significant weight. Even months later, she never fully regained her strength. Looking back, Dana's case review revealed she had already had 2 clean colonoscopies in the past, meaning this last one was unnecessary. This is why the U.S. Preventive Services Task Force advises most people to stop routine colon cancer screening at age 75. For those in excellent health and still wanting screening, safer non-invasive tests like the FIT, fecal immunochemical test, or stool DNA tests are often better choices. These tests can be done at home, require no harsh prep, no sedation, and still catch the majority of significant cases. The takeaway? Colonoscopy can be life-saving earlier in life, but after 70, the equation shifts. The risks often outweigh the rewards. If you or a loved one is being advised to undergo this test, make sure to ask, is it truly necessary? Are there safer alternatives? Because once you enter the colonoscopy cycle, it can be very difficult to step away. And now we've arrived at the most overused, most dangerous, and most harmful checkup for seniors. One that nearly everyone has gone through at least once. Stay with us, because what comes next could completely change the way you think about routine healthcare after 60. Number 1, annual full-body CT scans. These tests, often promoted in so-called executive health packages or marketed by private clinics as a form of ultimate prevention, promise peace of mind by supposedly catching cancer early. But the truth is far less reassuring. For older adults, especially those over 70, full-body CT scans may do more harm than good. Here's why. Each scan exposes your body to 10 to 20 millisieverts of ionizing radiation, which is the equivalent of roughly 500 chest X-rays in a single sitting. Radiation isn't just a temporary concern. It leaves behind permanent damage to DNA. Over time, repeated scans can significantly increase the risk of secondary cancers. A 2023 modeling study published in JAMA Internal Medicine suggested that CT scan use in the United States may now contribute to as many as 5% of all cancers. That places CT-related radiation exposure in the same risk category as alcohol consumption. A shocking statistic considering these scans are marketed as preventive care. The second major problem is what experts call the cascade of incidental findings. CT scans are extremely sensitive. They pick up tiny nodules, cysts, or calcifications, many of which are harmless and simply part of normal aging. But once these abnormalities are spotted, a chain reaction begins. More imaging is ordered, often followed by biopsies or even surgeries. Each additional step carries its own risks, anxiety, complications, and sometimes lasting harm, all for findings that would never have caused illness in the first place. Consider the story of Mark, an 80-year-old former martial arts instructor who was still teaching classes to seniors. He felt strong, active, and symptom-free. Wanting to stay on top of his health, he enrolled in an elite wellness program at a private clinic. His full-body CT scan revealed a tiny 3 mm lung nodule. Alarm bells rang. Within weeks, he was sent for a PET scan and then a needle biopsy. The biopsy revealed it was benign, but the procedure punctured his lung, causing a partial collapse. He was hospitalized for days and needed 2 months to recover his strength. What started as a precautionary test ended in a medical crisis, all for something that posed no danger to him at all. Medical authorities have taken a firm stance. The American College of Radiology explicitly advises against full-body CT scans for screening in people without symptoms. There is no proven evidence that they extend life expectancy or improve outcomes, while the risks, radiation exposure, false positives, unnecessary procedures, are very real. The smarter, safer approach is targeted imaging only when symptoms or red flags appear, such as unexplained weight loss, coughing up blood, or persistent pain. Think of it this way. Using a full-body CT scan with no clear reason is like combing a field with a landmine detector. Yes, you may discover something, but the chances of triggering unnecessary harm are far greater than the chance of finding true treasure. The real key to prevention, especially after 70, isn't scanning for hidden disease, but focusing on what you can control every day. Stay active, eat a nutrient-rich diet, maintain quality sleep, and work closely with a trusted physician who knows your health history. Choose your checkups wisely, not out of fear, but based on evidence. So there you have it, 5 routine checkups that may sound helpful, but can backfire, especially as we age. Modern medicine is powerful, but it isn't perfect. Sometimes doing less is the path to more health. Always ask your doctor, what happens if this test finds something? What's the next step? And are the risks worth the reward? Now, we'd love to hear from you. Have you or someone close to you ever gone through an unnecessary test that caused more harm than help? Share your experiences in the comments below. Your story might help someone else make a wiser choice. Thank you for watching, and don't forget, prevention starts with living well, not scanning more.